Bwrdd John Williams Lee Cadeirydd Iechyd Cyhoeddus Cymru. Ar ran y bwrdd, croeso cynnes i cyfarfod y Brydeinwr Mynyddol hyd. Croeso mawr i'n arsylwyr neu braf a'n cais i ben y byd o'r heddiw. A croeso arbennig i ddau aelod newydd y gwrs, Claire Virgil and Jim. Mae Iechyd Cyhoeddus Cymru yn gorff y cyffes ac yn gwario arian. Bydd y cyfarfod yn cyfle i ddod mewn mwy am sicrhau arian cael a'i waith. So there is a facility for questions to pose this morning because we do have a question and answer session. Those of you who are joining us on Teams can do so through that route, or you can email us through the Public Health Wales website. So this time last year, I spoke about the way in which Public Health Wales staff continued to respond to the COVID-19 pandemic, drawing on all their reserves in their commitment to keeping people safe. That commitment continued throughout 22-23, with staff integrating the pandemic response as business as usual, whilst also reactivating, recovering and transforming the services and functions. The Minister for Health and Social Services approved the 2022-25 integrated medium-term plan, complementing Public Health Wales on the quality of our plan. And our remarkable staff delivered 93.5% of the in-year operational plan, with all directorates working together, whether that's through providing frontline services, specialist national resources, services and policy advice, maintaining and building Public Health Wales' strong reputation internationally, and of course our all-important corporate services. The very successful year ended with the board approving the refresh of the long-term strategy, taking us from 2023 to 35, an ambitious groundbreaking strategy underpinned by equally ambitious strategies around research and evaluation, digital and data science, people, and the use of our asset base. The board and its committees had stretching work programmes during the year that were both future-focused and designed to take assurance against delivery of the in-year plans. The board had a major focus on training and culture. We signed the Race Council covering zero tolerance of racism, and the whole board undertook training on cultural competence. And this is an issue to which we will return in subsequent years. Now, last year saw a number of changes around the board table. In April 2022, we welcomed Caitlin, and then in May 2022, we welcomed Nick Elliott. We did agree to send David Evans out on loan to North Wales in March 23, just in a minute, I just make that up. And we said goodbye to Sally Atwood, to Mark Bellis and Helen Bushell, and we welcomed Angela Jones, Samina Hassan and Paul Daisy. And then we've also, as we said earlier, welcomed Claire Virgil and Jim Thomas. So, and it's a real pleasure for me as the chair to see how, no matter how many changes we have around the board table, everybody is assimilates quickly and the board really carries on with its business. So I am indebted to all my board colleagues for their commitment to and their passion for the public health agenda, for their focus on being a high-performing board, and for demonstrating unitary board governance model in practice. And my grateful thanks, as always, to Katie, who discharges the Vice Chair role with consummate professional commitment and passion, and I'm indebted to Kate for her wise counsel, her unfailing support and her advice to me. And I could ask for no better Vice Chair. It's been my privilege really to have her with me by my side in 23 and 24. And the Minister has asked me to convey her thanks to all our staff personally for everything that everyone has done to help protect the people of Wales and to improve health and healing. Now, I always refer to Tracy as a force of nature, as those who've been with us in previous AGMs will know. She's a truly inspirational leader, and that leadership style has been to the fore again this year. 2023 has been one of exceptional achievement for Public Health Wales, And I hope that Tracy, together with the outstanding executive team members, are justly proud of their leadership against what has been a hugely challenging operating environment. And of course, that exceptional achievement has included delivery against all financial targets, and that doesn't happen by accident. It happens because Hugh, George, and his expert finance team maintain rigorous financial discipline throughout the year. And it is at that point then that I will hand over to you to take us through the finances. Dr. PHW.
Diolch, Jan. Bore da pawb. Hugh George ydw i. Dwi'n dysgu Cymraeg, a blwyddyn nesaf dwi'n mynd siarad Cymraeg yma. So I've just made a commitment there in public. So I'm going to take us very quickly through a couple of slides for the annual accounts and some headline comments. But I would like to say to start with that actually what we see here is a very successful year for the organisation financially. And my huge thanks to both, as Jan said, the finance team for completing the accounts on time, but also across the organisation. It's been a really challenging year, a year of much change again, and the organisation's worked extremely hard to achieve its financial position. So in terms of the first slide, in terms of headlines, our accounts were approved by the board back in the summer. We submitted them to the Welsh Government on time, and they had an unqualified auditor opinion from Audit Wales, which, as you most probably have realised and read in the press, that is actually relatively unusual in Wales this year, so that's a really successful point for us all. There were a number of challenges this year, just technically, challenges with the deadlines, but also challenges with some of the new accounting treatment. And you'll see some changes in the accounts in terms of IFRS 16 in respect to leases, and that changed many parts of the accounts throughout the whole thing. And naturally, what I would say is, as we're doing it every year, we're undertaking post-project learning at the moment with colleagues to see how we could do things differently and improve on it next year. So in terms of the next slide, as Jan said, we hit all our financial targets. And I think we're in a relatively rare position to be able to say that we did that in what I would say is increasingly challenging times. We reported a very small surplus. We met all our statutory duties to break even, and that's a break even over a rolling 3-year period, so that's important to bear in mind. And that's the record that we have as an organisation. We do break even every year, and we have broken even every year since we were established. I think it's important for the board to be proud of that, actually. We've got an approved strategic plan, as we call it, an integrated medium-term plan. And I think, as Jane quite rightly said in the introduction there, it is worth recognising that the Minister, when she attended our board meeting during the year, held this out as being an exemplar for other organisations as well. So I think it's worth us actually being proud of that as well. And again, the final duty there, the administrative duty to pay 95% of non-NHS bills within 30 days, we continue to meet that. May sound easy, but actually when you have an organisation spread across many facilities across the whole of Wales, sometimes actually just sort of managing that one can be challenging, but we met that again. There's a couple of slides then. In terms of the next slide, yeah, the accounts do look different from the previous year in terms of what the expenditure looked like. Yeah, and I suppose the first thing to say is no, we're not a shrinking organisation. It wasn't, the expenditure's not dropping because the organisation's changed. Primarily, you'll see the biggest decrease in expenditure last year was COVID testing. As you would expect, the levels of COVID testing reported in the previous year, I think it's right, as it says there, £47 million more the previous year than we did last year. But there are other items which obviously work against that. Pay costs increased last year with National Pay Awards, all of which were fully funded by the Welsh Government. We are still, as the hosting body for the NHS Wales Collaborative, as it was last year, our accounts include their expenditure and their income, and you've noticed that obviously there was a large increase in non-pay expenditure in the voluntary hospice funding last year. So a couple of sort of the big issues there. I will move on very quickly to capital. Capital is a challenge for this organisation, will continue to be a challenge for this organisation. We have a very small discretionary capital allocation each year, which we regularly use on essential items. And that means we have to speak to Welsh Government for the bigger projects. And one of those last year we completed was Press Test Wales imaging equipment, and that programme was completed last year. One item that didn't appear on our balance sheet at the end of the year, but a lot of work was needed on it during the year, was the link lab information and network Cymru and the radiology systems, which were both developed as part of the NHS Wales collaborative, but transferred out during the year to Digital Health and Care Wales. So again, there's quite a lot of work around those. And again, if you're looking at our capital, you'll see quite a lot of differences because leases came off the balance sheet last year in terms of IFRS 16, and therefore there's quite a large change there. So there's just a couple of headline figures. I think the main thing that I wanted to say was that the organisation is a really big well done and thank you. We've hit targets again, and we went into this year having submitted an IMTP, which is now being approved, and a balanced budget for this year. So thank you. Yeah.
Diolch o galon i chi. And profion next slide Tracy. Bydd Tracy yn siarad am diblyniadau y llynedd ac yn edrych ymlaen. Our next presenter is Tracy, who is going to take us through the achievements of 22-23 and to look ahead.
Diolch Jan, brought up how Tracy doing. Just before I do, just to reiterate what Jan said, a big thanks to Hugh and the team and everybody across the organisation for yet another really strong end-year position financially. As Hugh's outlined, meeting our financial targets aren't activities that come easy. It's a lot of hard work, and considering the challenges in the NHS financial position as we speak, our management last year and into this year goes as well in adapting and supporting a very challenging environment. So I'm going to just share some highlights of achievements. I have to say, it's always, I say this every year, it's impossible to cover the massive extent of just amazing work that goes on every day across the organisation. And I would just encourage people to have a look at the annual report that we also published today, and that gives you a really strong picture of everything that's happened, and some we bring it to life with some case studies, some stories with partners as well. So really encourage people to have a look at that. So what I'm going to share is very much a summary. And if any of our wonderful staff are watching, apologies if I've missed any of our people's work out in the summary. And before I start, just to say, as both Hugh and Jan said, a massive deal to all of our staff. As we reported for the last few years, as a public health body, we've gone through a challenging, as everybody has, number of years in leading and responding to the pandemic. And of course, we're facing into many public health challenges, and yet again, over the last year, every single one of our staff has just been above and beyond and fully dedicated in protecting our public and improving health and well-being. So a massive work of our humanity. So just a few highlights then. As Jan said, the last year was our first full year of reactivation. Many people through COVID knew us as being an organisation that did health protection. Well, we covered the breadth of public health functions, so it was excellent for us to be able to reactivate everything. And the fact that we were able to grow with 300 staff during COVID into our health protection and our infection services allowed us to do that. So our response to COVID is very much mainstreamed, but on a larger scale now, and integration into business as usual. And as Jan and Hugh have said, that reactivation of our year culminating in an excellent delivery of 93% of our IMTP milestones that we set out. I'm going to come back to a little bit around the long-term strategy, but it was a really important year for us, led by Hugh and the team, and everybody contributed, many of our staff across the organisation, given that we are not only facing COVID, but the cost of living crisis, the challenges of the war in Ukraine and our opposite climate change. So of course, the role of the board is to set the strategy of an organisation. So we had to spend the last year looking at what that strategy would be going forward. So a really important activity over the last year. But what was very important for us last year, and still is this year is our people. With the professional and personal trauma that many people have gone through over the last number of years, it was really important for us to focus on engaging with our people, led by Neil and the team. What does that place of work look like? What does balance of work life existence look like, that are really innovative work, how it works best, pilot that we are now embedding through the last year and looking to embed across the organisation, and that really changes the interaction between each of us and our managers. And we have the most amazing staff networks. We added to our networks with Welsh Language Network and Men's Network over the last year, and we had our first full conference just in the beginning of this financial year. But without our staff networks, we would really struggle in really challenging ourselves in being as diverse and supportive to enable people to be as comfortable and supported in the workplace. So a really big deal to all of our chairs of networks and network members. And the whole focus for us, obviously, we're a public health organisation, sustainability and climate change is key, but not only that, our focus on driving improvements in the quality and impact of our work right across the organisation, transforming our approach to digital data and evidence has been really key. Next slide, please. Screening has been a very big focus for us. Anyone watching may be aware that given the challenges of COVID, we were forced to pause all of our screening programs apart from our antenatal and newborn hearing screening for 3 months in the middle of 2020, and to reactivate screening programs when you haven't had activity has been massive. And so the team amazingly continued to recover our backlogs, the bowel screening in September, the smart screening in December, and for our abdominal aortic aneurysm in March. So really big achievement there. Still ongoing challenges with our breast test Wales and our diabetic eye screening program, as we see increasing referrals for people with diabetes month on month. But in the midst of all of that, supported by Ian and the team, our screening services have just taken a very different look at how we design our programs based on our participants and our service users. And we also opened the second of the Health in the High Street screening unit, thanks to all of our estates team and our screening team in Hibley House in Llanilltion. And our total screening episodes for the year, 712,700, which are massive, and each of those makes an impact on our population. Our microbiology and infection service, yet again, managed to achieve all of our turnaround times, which is in the context of a very much scaled up service, and we could see 1.6 million samples processed through the year. Less of those were COVID than the previous year, but a real increase in the breadth of infectious testing and innovation, new platforms, new technology. We also established a public health genomics program. We've reported previously that during COVID we scaled up our pathogen genomics, which looks at the DNA of infections, and COVID particularly, which we were third and fourth alternatively in the world. And so taking that to the next level for Wales and our role internationally has been really important. Led by John and the team, our Improvement Cymru team, we're just alongside the NHS in a way that we've never been before, supporting them through that recovery, the NHS pressures, and establishing the Safe Care Partnership for every organisation in Wales, which has been key. Looking at how we do our mainstay functions has been really important to us. As I mentioned earlier, he is supporting the team in screening, but also looking at what do our users feel about our website, our registries. So opening ourselves up to learning through the views of others to be better and better has been a really important focus. And also we scaled up our knowledge and our data around the population, looking at what is the state of health in Wales, looking at through the lens of a number of different areas. And our team in our data knowledge and research established a real-time suicide surveillance system. It's very sad that we had to, but that has been really important. They did it in a very quick time, and we know it's been very much appreciated by partners, but also ministers. Next slide, please. A very large achievement for us, led by Samina, is our establishment redesignation for our World Health Organization Collaborating Centre on Investment for Health and Wellbeing. So after the first 4 years, we've just increased and accelerated our support to the WHO and our learning internationally to bring back to Wales. So that's a really important achievement for us, and very much consistent with a globally responsible Wales in the Wellbeing Future Generation Act. And under Samina's leadership in the Policy and International Health team, last year, we hadn't anticipated at the beginning of the year. As the cost of living crisis accelerated, the team were very agile, and over a very short period of time, we undertook some work to take a public health approach to the cost of living crisis, which we published. This was received very strongly by Cabinet, and Samina, who presented that to the Welsh Government Cabinet, has also been on an expert panel. And obviously, that from a public health perspective, cost of living crisis is really clear about how we help people get on top of that. But also, similarly, as a result of COVID and work that we've done prior to COVID, people have been really impacted by what can be quite traumatic life experience and work experience. So an international first in a national trauma practice framework was developed by the team, by our Adverse Childhood Experience Support Hub last year, and that takes a whole system and a whole society approach from children and young people all the way through to older adults to support people in difficult times with their resilience. And then really, really key for us, and very much our bread and butter, we were able to reactivate fully our health improvement programs. We launched a really innovative All Wales diabetes prevention program. We've been working very, very closely with education and Welsh Government and other partners around a whole school approach to really embed mental wellbeing support to children and young people, and that whole approach to healthy weight has been key. And we've been alongside the Welsh Government in the whole Healthy Weight, Healthy Wales, and published a very, very strong Healthy Weight, Healthy You website. And of course, we're an NHS organisation. We're subject to all the statutory legislative requirements. During the year, the Welsh Government established a new Equality and Engagement Act, which imparts on us the duty of equality and duty of candour. So under former Rhiannon Beaumont-Wood, our former Director of Quality Nursing and Health Professionals, and John Bolton's leadership, the team have really been pushing duty of candour and duty of equality across the organisation. Thanks, Rhiannon. So that just gives a very, very large flavour. And again, as I say, please have a look at the annual report, because that just brings it all to life. I can't do it justice in a couple of slides. But as an organisation, we're always looking forward. We're always trying to look at what that horizon looks like a couple of steps ahead. Next slide, please. And so, as we've all mentioned, under the oversight of the board, we spent last year engaging with 500 of our staff, led by a number of senior managers across the organisation. We engaged with partners, we looked at the evidence, and we asked the public what they thought our priorities were. And as a combination of that, we approved in March this year our new long-term strategy, Working Together for a Healthier Wales, which takes us to 2035. And there are 6 new strategic priorities there, focusing on wider determinants of health, looking at the cost of living crisis, employment, housing, second one looking at promoting mental and social well-being. How do we support mental well-being, mental health for all age groups across the system, but also support people in their own resilience. Looking at promoting healthy behaviours, how do we help people, all of us, to make different choices that keep us healthy, particularly around alcohol, smoking, physical activity, delivering excellent public health services to protect the public and optimise outcomes with our screening services. How do we reduce inequalities in uptake? How do we ensure that we are amongst the best in the world in providing health protection and microbiology services? And then supporting a sustainable health and care system focused on prevention and early intervention, which is a prominent and dominant part of our conversations with partners in the NHS at the moment. How do we shift prevention and really drive avoidable disease to improve outcomes for our population? Finally, a new strategic priority for us, although we've been doing a lot of work on this for many years, under Samina and Hugh's leadership, is tackling the public health effects of climate change, which is just going to accelerate for us over the coming years. So finally, Jan, before I hand back to you, I just want to say again, a really very, very large to all of our people. It's just wonderful every day when we're out and about meeting our staff who really do go above and beyond, and there's a divining rod of passion to make a difference across all of our people. A really, really big thanks to all of my executive team colleagues. Jan, as you outlined, we've had changes through the year. We've had people acting into roles who've just been phenomenal in their leadership, and it's been a pleasure and an honour to be working alongside my executive colleagues for the year, and finally a massive thanks to all of our non-executive directors who provide the challenge and the support in difficult times, and the expertise that you all bring is fantastic. And Jan, personally, I wouldn't want to be alongside another chair. You just your undividing loyalty for the organisation and innovation and that strategic thinking has been exceptional yet again. So diolch Maria.
Diolch o galon, Tracy. And of course, we are missing 3 of our board members today, Meg Cole, and Diane Crowe, but of course we are incorporating our missing colleagues in the plans to work with the board for the whole year. So we do actually have a question and answer session, but I scan into Christina and Mr. Wada, please. Do we actually have any questions, please? Happy online. So, and is there anything in the room that anybody would like to visit?
Silence.
Well, we will take that as an indication of just how much we do contact about the work that we do. And obviously, you are on watching us online now. You're very welcome to our report and candidates, as Tracy said. So, dyma ddod y cyfarfod cyffredinol blynyddoedd wedi derbyn. Diolch yn fawr Tracy ac Hugh am ei cyflwyniadau. Diolch i chi gyd am eich amser bore heddiw. Byddwn ni'n edrych ymlaen at eich gwerthu eto y flwyddyn nesaf. Cymerwch ofal a rhaid nawr.